You said we do a blood test. Like, what are you checking in the blood? Just what are you taking the blood tubes and what are you actually checking?
So there's a variety of approaches to that. At Exact Sciences, we're currently looking at a series of protein biomarkers and a series of DNA methylation biomarkers. So what what we detect in the blood there is the DNA that comes from the cancer. DNA, of course, is the nucleic acid that codes for human life, and DNA circulates in the blood both from cancer and from normal human tissue. We're able to look for methylation patterns that are unique to cancer, and that's how we use DNA to look for cancer in the blood. Methylation is a chemical modification of DNA that happens both in normal tissues and in cancer, but it happens in different locations depending on whether we're looking at a cancer or a normal cell DNA. There's also DNA mutations, and one of the uh, prior versions of our assay looked at DNA mutations, and we're continuing to evaluate DNA mutations as a biomarker for potential inclusion in our assay. And there's other things you can look for. You can look for extracellular vesicles. You can look for aneuploidy. You can look for DNA fragmentation. So different companies that are developing tests in this space are looking at different biomarkers. But what they all share in common is that these are blood-based biomarkers. They're released from cancer,